This is Group 42's presentation. Before we begin, I would like you to meet Mr. Samagam R. Raju. Mr. Samagam is 76 years old and has been living alone in a one-room flat for the past 9 years. A divorcee with no family, he spends most of his time watching television in bed. Parkinson's disease and osteoarthritis have also confined him to a wheelchair, preventing him from ever leaving his immediate neighborhood. Nobody ever comes to visit him. In an interview with Insight by Straits Times, Mr. Raju said, "I was born lonely with no siblings and I will stay lonely and die lonely." Unfortunately, Mr. Samagam's story is not unique. Studies by World Health Organization show that social isolation affects 1 in 4 older adults, and this number is even higher in Singapore. With so many elderly in Singapore suffering from this presents a significant problem statement. There is an increased prevalence in social isolation amongst seniors, which can lead to a rising number of seniors with health issues in Singapore. Social isolation refers to the objective state of having few social connections with others, and this is closely linked to loneliness, which is more of a subjective emotion. Social isolation affects elderly people more in Singapore, especially those who are not working or unmarried. While health decline comes naturally with aging, social isolation and loneliness can significantly increase the rate of health deterioration. In fact, it's the number one social factor that contributes to rapid health decline and early death amongst the elderly. Studies show that social isolation can negatively affect one's physical, cognitive, and psychological health. This poses a great public issue for all Singaporeans, especially if insufficient measures are taken to combat social isolation. This, when left unchecked, coupled with Singapore's aging population, could lead to excessive burden on Singapore's healthcare system. Studies show that socially isolated people have high chances of being readmitted to hospital only after 2 weeks of being discharged, as compared to their more social counterparts. As such, hospitals will have less space to accommodate new patients who will also require care. Additionally, more medical resources and hospital staff will be needed to take care of higher patient intake. With overloaded hospitals, the government may also need to allocate more funds to expand hospitals and staff. As a result, the cost of healthcare services in Singapore will increase, creating a public issue.
Now, let's take a look at some factors affecting the increased social isolation in Singapore. Historically, Singapore has transformed into a smart nation over the past decade. Since the launch of the Smart Nation Program Office by Prime Minister Lee in 2014, 99% of resident households and 93% of senior-only households have access to the internet. This shift in technological landscape has brought about a change in activities of seniors, including communication and leisure activities. Due to the increased digital usage by seniors, many of them are developing social media addiction. Studies have shown a higher average addiction intensity for digital media compared to traditional ones. Usage of platforms such as smartphones, social networks, and television trumps conventional ones like radio, print, book, and theatre. This has brought about the engagement difference between conventional and digital media. Digital media provides a more personalized content, which caters to individuals better, while conventional media provides a more fixed and generalized content. Digital media is also more accessible and convenient compared to traditional media, as most content can be accessed from smart devices. This contributes to higher process and content gratification that digital media can provide in contrast to traditional media. As seen from the graph above, digitally active seniors generally engage in fewer social activities, such as family visits and hobbies. This difference in social activities has a massive impact on the social opportunities for seniors, which gives rise to more socially isolated seniors. Activities that used to be more common before digitalization are becoming more obsolete in today's smart society. Despite digitalization bringing about more forms of communication through digital platforms, this hyperconnectiveness has brought about a loss of many social activities due to fixation on these digital platforms. Hence, the shift to a smarter and more digitalized nation has also inevitably brought about increased cases of social isolation among seniors.
Now, on to cultural factors. Singapore has changed dramatically, from kampongs in the 1960s to vertical HDBs today. While a necessary step in Singapore's progress, it has led to the loss of the kampong spirit. The kampong spirit outlined by Lazaru is the sense of community and neighborliness felt in the village. According to Lazaru, this is where the community will come together to help and sustain each other, providing social cohesion and community support. In the past, communities lived together as an extended family with doors kept open and neighbors would keep a lookout for each other. However, today, patterns have changed. Doors of HDBs are often seen closed, and deep neighbourly interactions, such as keeping a watch over flats and helping to look after children, has become less often. These show that community support for seniors is vanishing. Why is this significant for our seniors? Community support plays a vital role in senior social participation, fostering social interactions. Furthermore, particularly for seniors, they tend to be more community bound, spending a bigger proportion of their time in the neighborhood. With opportunities for social participation diminishing, so does daily interaction, leaving them more vulnerable to social isolation.
Another cultural factor that contributes to social isolation among older adults is their reluctance to seek help. Many seniors prefer to manage on their own, as they often feel that asking for help will make them a burden to others. This sense of self-reliance and fear of troubling family members is a common cultural attitude among the elderly. Studies have shown that less than half of seniors seek professional assistance, and many turn only into informal sources of support. Others may even avoid treatment altogether to maintain their independence. This reluctance to seek help creates a cycle that reinforces social isolation. It begins with a burden mindset, where seniors believe that relying on others is troublesome. As a result, they often avoid seeking help, resulting in limited support from both the families and the community. Over time, this lack of support can cause them to withdraw further and become socially isolated. Overall, cultural beliefs surrounding self-reliance and independence strongly influence the help-seeking behaviors of older adults, highlighting the need for greater awareness and community encouragement to break this pattern.
Another structural factor exacerbating social isolation amongst the elderly is the increase in number of young adults moving out of family homes and living physically apart from their elderly parents. The Singapore government has introduced a plethora of housing grants and schemes to make HDB flats more affordable and accessible for Singaporeans, mainly for young couples and singles over 35 years old. This encourages and enables more young adults to purchase and move into new HDB flats when they form families of their own. And as a result, more young adults are moving out of their family homes and no longer live under the same roof as their elderly parents. This trend is reflected by population data from the Singapore Department of Statistics. Between 2023 to 2024, the percentage of married couples under 35 years old living in their own households rose from 54.9% to 56.3%. The percentage of adults between 35 and 49 years old living alone also increased from 12.6% in 2023 to 13.6% in 2024. Young adults who are not eligible to apply for BTO flats instead turn to rental housing. And this increased number of people renting is reflected in the increase in the percentage of adults under 35 years old living alone from 15.6% in 2023 to 17.5% in 2024. Naturally, with more young adults moving out of their family homes, more elderly people end up living by themselves and apart from their children. This is highlighted by data from HDB Sample Household Survey 2018. The percentage of elderly adults living together with their married children decreased from 17.2% in 2013 to 11.4% in 2018. As a result, the elderly will naturally interact with their children less frequently, and this is also reflected in HDB's survey data. The percentage of the elderly who had daily visits from their children dropped from 23.7% in 2013 to 18.2% in 2018, and the overall percentage of the elderly who were visited by their children at least once a month or more dropped from 89.2% in 2013 to 86.9% in 2018. With less frequent visits from their children, the elderly naturally have less meaningful social interaction with their loved ones, hence exacerbating social isolation.
Moving on to the structural aspect, 2 points stand out: the inequality linked to low socio-economic status and the role of poor education in increasing social isolation. First, it's important to note how loneliness and isolation are interlinked. A longitudinal study found that loneliness rises not only with higher isolation, but also when someone feels more isolated than they used to. Life events that change isolation levels often trigger shifts in loneliness. Instead of seeing one as the cause of the other, it shows that the two elements reinforce each other. For elderly living in rental flats, a 2019 study showed that 32% of seniors in rental housing reported loneliness, more than double the rate of those in non-rental homes. Rental flats often reflect lower income, fewer social resources, and sometimes weaker support networks. The same study reports on how poor perceptions of physical environment in rental housing estates, such as litter and poorer street lighting, were associated with higher odds of loneliness. These conditions reinforce the stigma of rental housing and distinguish residents of rental flats from non-rental flats, resulting in an increased isolation and loneliness. The high turnover rate of residents in rental housing also plays a part, as residents will not try to form social connections due to difficulty in maintaining them in the long run. Education shows a similar pattern. A 2021 study revealed that compared to those with secondary school education or higher, the elderly with only primary education were 1.2 times more likely to be socially disconnected, and those with no formal education were nearly 2.5 times more likely. This suggests a clear trend. As education levels decrease, the risk of social disconnection increases significantly.
For the recommendations, we have targeted both the individual support and the community support given to the seniors. Under the individual support given, we have the Silver Generation Office, or SGO, which is a national agency that engages and supports citizens above the age of 65. Their outreach efforts aim to allow volunteers to connect with seniors to understand more about their financial and social situations. However, SGO only provides 15 hours of mandatory training for their volunteers, which is inadequate to equip volunteers with the skills needed for outreach. This is in comparison to other community social workers, such as the Singapore Association of Social Workers, that have extensive training periods of up to 15 weeks and on-site training as well. Inexperienced volunteers might not be able to deal with the emotional breakdown of seniors. Volunteer befrienders might also misinterpret verbal cues given by the seniors that indicate that they are in need of help. This results in ineffective visits being done by the Silver Generation ambassadors. So what can we do to resolve this problem? In the short term, we could make use of prospective allied health professionals, also known as AHPs, and medical social workers who are studying to tag along with these ambassadors under their clinical trials. These AHPs are trained to pilot the conversation into other topics if it gets too emotional or personal for them to handle. They are well equipped with the skills for understanding and identifying seniors who may require help from other social organizations. We do understand that this resolution may only provide short-term relief, as students are not available all year round. Hence, in the long run, when the prospective AHPs are tagged to the ambassadors, they are also required to hold basic skills training workshops for the ambassadors. With the upscaling and training given, ambassadors would then be able to hold their own weight when the prospective AHPs are not available to support them. Next, we will be moving on to the second part of our solution, which mainly focuses on community support.
Now, we are focusing on our AACs, places that are vital in keeping our seniors physically, mentally, and socially active through hosting a wide variety of activities, such as physical fitness, karaoke, and musical classes. But we need more seniors to take part. Despite AACs having a huge potential to combat social isolation, the senior participation rate has been low. Data from MOH and SingStat suggests that in 2023, roughly only 1 in 4 elderly who have access to an AAC has attended an activity. So how then can we get more seniors to participate in these activities? Our team has come up with a simple but effective solution. AIC can incentivize seniors to participate in AAC activities. We can do so through a rewards card system, where seniors will earn 1 stamp for participating in an AAC activity per day, which can entitle them to a free kopi or tea at any kopitiam-operated food courts. We are proposing that on their first stamp, they get a taste of the reward, encouraging them to make the first move to come to an AAC. Subsequently, on their 6th or 12th stamp, they will receive a free reward again, which can encourage continuous participation amongst our seniors. We chose Kopitiam for AIC to collaborate with because a similar partnership already exists between Kopitiam and the Health Promotion Board through the Healthy 365 app, where users can earn health points through healthier living and use them for rewards such as a $5 Kopitiam e-voucher. AIC can build upon this existing MOH Kopitiam partnership to provide incentives for AACs. To keep it sustainable, we are keeping it simple. The rewards cards expire every month with no carryover. Each senior can redeem up to 3 kopi or tea per month, capping costs at $3 per month per senior. This keeps the program at a low cost for providing meaningful incentives. And with that, we have come to the end of our presentation. We urge MOH to consider our solutions to combat social isolation effectively. Thank you.